Richardson. Welcome.
Hi, how are you today?
I'm doing well. I'm doing well. It's a Friday, so I can't complain, to be honest with you. Although our times are, you know, let's call them interesting. The shutdown that just happened a few days ago, it's putting a damper. I'm in DC. You're in DC, correct?
Yeah, I'm
Yeah.
in Mount Pleasant near Rock Creek Park for folks who know the district.
Yeah, yeah. And so we are in a special situation, so to speak. Um, Before we delve into that context, you're currently interim coordinator, the DC Coalition on Long-Term Care, right?
Yes, sir.
And that's we were talking just before the recording. That's a part-time um, engagement with them, right?
Yeah, so the DC Coalition on Long-Term Care has been around for over 30 years. We've had a variety of funders over the decades, and it's been a pivotal organization advocating for long-term care issues over the years. Right now, we're really focused on workforce issues, and we'll probably talk about that later.
Yep.
Uh, but I came to this as kind of through a back door. I was the deputy director at a nonprofit here in the district called DC Appleseed, which is also an organization that's been around for a long time. And the organization has been having a lot of funding challenges. So I was actually laid off a year ago. But one of my projects was long-term care. And I was managing our whole portfolio of work while I was at Appleseed. And it was an issue. I've done a lot of policy work. I've worked with three mayors as a policy director and the strategic planner for Washington, D.C. So I knew a lot of the top of the head talking points for long-term care issues, but I didn't really know a lot. Uh, but once I was at Appleseed and I was given this portfolio, um, the I didn't realize how important of an issue this actually was, particularly with all the boomers that are retiring all the
Yeah.
way. So I'm currently in the coordinator. I'm going to be here for the near future while I search for the next best opportunity. But this is an issue that I'm going to stay very connected to, and it's I'm part of the steering committee, and I'm aging myself. I'm going to need some of these services in the near future. So I'm going to stay on this.
Yeah, yeah. And so what is long term? When you say it's an issue, what does that mean? Long term is an issue. Long term, sorry, long term care. I'm sorry, long term care.
Mhm. So long-term care, as an issue, as people age, we slow down, and there's a variety of services that people might get,
Yep.
and it's not just older people, quite frankly, it's people of all ages. Some people are disabled. I was speaking to someone recently who was running in Rock Creek Park, tripped, fell on the road, and actually got hit by a car.
Oh my gosh,
This person's in their 30s, but they required long-term care for 6 months. So they had to get a home health aide to come in to help them take their trash out, to feed them,
I see.
um, clip their toenails. And with older residents, you have all these issues compounded. They might have, they might have to cook them food, change diapers. There's all of these issues that able people take for granted. Uh, but all of a sudden, you fall down while you're running, or you get to a certain age and you can't do them. We rely on long-term care workers.
Okay. So it's basically instead of coming in and sort of taking care of one particular aspect, right? Your long-term care is saying, okay, there is a life to be lived. This person is not able to do the things that they need to do. Some of them very basic, and so there has to be intervention that is thoughtful and sustainable and so forth, right? That's the sense I'm getting, right?
Yeah, and during the pandemic, the long-term care workers were considered essential workers uh,
Mm.
because we're all of us were housebound for a long time,
Yeah.
particularly folks that needed these special supports. So we found out just how important these workers are, and they have to have a variety of skills. And they're not paid well. They're paid minimum wage in most places around the country. But they have to go through 120 to 130 hours of training to get their certification to become this really essential worker in a whole lot of people's lives. And quite frankly, with the pay, there's a lot of turnover in the industry. I've seen, in the Washington, D.C. area and lots of municipal areas around the country, you might have 50% turnover. So you train a whole group of folks and they work in this very complex sector where they need a variety of skills. They got to, they might have to cook. They're going to have to be able to be strong enough to take trash out or
Yep.
to move someone from their wheelchair to their bed. It is a skill that requires a whole lot of different capacities and trainings. And a lot of people aren't cut out for it. It's really difficult. And there's also a lot of caregivers who are family members. And a lot of us are going to rely on family members because we maybe, a lot of, if you're low income, or you're not going to be able to afford to bring in someone from your house, or there's not going to be a program available to help supplement bring in someone in your house. So this is an issue. All of us are going to have to learn a lot of these issues, but at a
Yep.
certain point, you're going to need to get someone skilled, like a certified nursing assistant or a home health aide, in there to do these things. And we don't afford them the respect as a job industry that we should.
And so are most of these folks who are doing all this very important work, are they, where does the money come from to pay for their services?
Some of it can come out of pocket. So, if you're wealthy, you have the ability to pay someone more than a minimum wage, and you can do that. But many folks, middle income, you're making, 50, $60,000, $70,000. You can get money from the municipality, the place that you live, and you can get reimbursed for that. If you're on Medicaid in Washington, D.C., there's a 70% reimbursement rate for that. So if you're paying 50, $100 an hour because an agency hires these people, the money goes to the agency, and then the agency then pays the workers for the hours. The district will get $70 from the federal government, and then $30 comes from the local area. Uh, Washington, D.C. is a little unique. Most of the rest of the country, it's a 50% reimbursement rate. So it's going to be 50-50.
Gotcha, gotcha. Is there, since you're knowledgeable in the space, is there just like in senior living, right? There is sort of the posh ones, right, where all kinds of amenities and for the folks who can afford it, and then you have affordable housing, right? In this space here, of long-term care, are there sort of like outfits where it's sort of almost a valet or whatever, right? Who comes to your house, takes care of things, and they're expensive and they're paid for. And then you have the others who are paid a lot less because the clientele can't afford to pay them, you know, what they are worth. Is there this sort of dichotomy, or sort of, the rich guys, they have a certain kind of, and then you have the rest of us who don't?
Well, if I get the gist of the question, yes, wealthy people end up getting the better care because what will happen, it's just like sports. You get a superstar home health aide or a CNA,
Yeah,
they'll get hired away by an agency, and they'll go and, they can get $40 an hour instead of $20 an hour. And the other thing where this uh, plays out is training and education opportunities.
yeah,
So if you become part of a kind of a well-heeled, well-funded agency, they can pay for you to get a higher certification. So you could become a certified medical assistant. They could put you on an education path where you become, all the way up to a nurse, and theoretically a doctor, even
Yeah.
if you go to the right, the right place. And so certain aides, or personal care assistants, PCAs is kind of what they call it in the industry.
Hmm.
If they're get attached to a well-funded agency, they can get on an education pathway that can lead them all up, to becoming a nurse or a doctor. In most places,
Really?
though,
Yeah.
the education pathway is very murky, particularly here in Washington, D.C. There is no education pathway for adults to go to advance their careers. The city, Washington, D.C., has finally begun to prepare high school students for these jobs. But once they graduate from high school, there's no real functioning community college in Washington, D.C. to then pick up this
Mm.
training. With all across the country, it's community colleges and career and technical institutes that are the leaders in training these workers. And so DC residents, and this, plays out, a little bit differently other places, but DC residents have to go to community colleges or a training institute, most often outside the city, to Northern Virginia Community College or PG Community, Prince George's Community College.
Gotcha, gotcha. Okay, let's take a step back and I want to refocus on your job and your day to day as well as the big rocks. What are the big things, the big problems you're solving with the coalition that you're heading?
But, we've been talking about workforce issues are a huge focus. Um, what's happening in the district, and again, the district in this context for folks that are not in the Washington, D.C. area, the district is not a state, but it has a lot of the same state functions as any other state. So our city council and our mayor actually operate like the Congress, and the mayor is like the president. And so we have a system of checks and balances, and we have an education system, both elementary system and also a higher education system. The reason why I mention all that is because, like we see across the country, uh, there is not a lot of coordination
Mm,
between what's going on in government and what's going on in the healthcare sector, working with hospitals, working with higher education institutions. Like I just said, that Washington D.C. doesn't have a post. Doesn't have an adult education training system for healthcare workers.
mm,
There's a lot of talk about creating a system like that, but right now there's not. Um, but in some states, and again, every state is organized a little bit differently. But in most states, a person of any age can walk into a career and technical institute or a community college, and you can get a variety of series of trainings to go as far in your career as you want to do. And what that requires is a lot of communication from the executive, from the council, so that the community college is well funded, or it might be part of a small state college, where it might be. But there has to be this communication between local government and higher education. And if you don't have that, you really can't create an ecosystem where people can go in one door, and then enter, and get a beginning job, an entry level job, whatever that might be in the health industry, and go all the way up to, a higher ed, a job where you can uh, pay to send your own kid to college, or, to reach
yeah,
middle income.
gotcha. So workforce is one. What else, you guys?
Uh, you know, when you talk about long-term care, it's almost the way we work on it here in DC. It's almost all about workforce.
Mm,
because we're working on pay, we're working on job benefits, we're working on education pathways. So
Yeah.
in Washington, D.C., we're literally advocating we need a real community college, or we need a partnership with the out-of-state, with Maryland and Virginia community colleges, so that DC residents can go and pay in-state wages in Maryland and Virginia to get the training that they can't get here in Washington,
Yep.
D.C. So we literally
Yep.
have to, do that. And we are literally in a workforce crisis
Yep.
in Washington, D.C. All across the country, there's a lot of pressures on this industry, but there's few places that I know of that has the significant challenges of Washington, D.C. filling these jobs because we don't have this adult education system.
Yeah. And
Uh,
these jobs are critical because they impact directly, the quality of life of many, a big cohort of human beings that is growing, as you said, right? The boomers, that's probably isn't it like the biggest growing cohort is, I don't know, 80 plus or something like that, I heard?
yeah, well, I think probably anyone listening to this podcast, the boomers are retiring, in droves every day, and I'm actually born in the last year of the boomers, so I'm considered one of those people. So, it's a kind of a two-pronged thing.
Yeah.
So we have uh, tens of thousands of people retiring every day all across the country. Um, some are going to continue working for a few years, but everyone's going to slow down. We're going to reach the super agers, which, kind of considered people 80 and above. And that super age population, 80 and above, uh, is going to grow. And of
Yep.
course, the older you get, the more services you're going to eventually need. So we have that reality happening. But there's another reality that is also uh, connected to this, and that is not only are we aging in the United States, but our society is becoming much unhealthier. We've got diabetes issues, obesity issues. The country is not healthy. And so, just as I said, earlier in the podcast, it's not just elderly people, or disabled people, the traditional populations you think that need long-term care, but it's actually more and more young people who are not engaging in healthy living, who are needing more and more services. And so when you look at the amount of workers in our workforce, as this crush of boomers retiring and people living, leading unhealthy lives, smoking, eating the wrong foods, drinking sodas, it's crushing this workforce system. And again, because the wages are low,
Yeah.
um, it makes it really hard to keep it fully staffed. And you can look at all the data and the research. Unfortunately, many folks in low income communities have poor lifestyle, live a poor, unhealthy lifestyles, partly because they're in a food desert. They don't have
I think it's expensive to have a healthy life.
it is expensive to have a healthy lifestyle. And so this is the population that is going to need the most care. And it's the low income population that is going to be really have the most challenges getting the services they want. Because if you make a lot of money, you can always figure this out.
Sure.
You can pay out of pocket. You can, find someone, to take care of you. But if you're low income and you're relying on Medicaid for your health care, particularly in this current administration, um, it's a really tough road to hoe.
Yeah. Do you think that this is a symptom of a prevailing problem, I would say, or philosophy or disposition, or whatever may call it, which is, at least in the United States, um, we don't deal with the problem until it becomes a crisis, right? We don't prevent, right? We do, we have a great healthcare system if you have the money and you need some kind of really expensive surgery and whatever, and then okay, we're number one. But otherwise, prevention seems to be just a thing that we don't do, feels to me, across the board, right? Which one can explain it? Hey, who makes money from prevention, right? Nobody makes money, right? So
Right,
businesses
right,
are always about, okay, well, we are hospitals and we make a lot of money from diabetes. What motivation do we have to reduce that customer base, if you want to call it that? If I want to be cynical in that sense. So do you think that this thing about long-term care is about, okay, long term, right? So we have to think strategically. We have to think about prevention. We have to think about budget. We have to think about all kinds of things that require sort of deliberate planning as opposed to reacting, right? So there's money. There's money. I mean, this is a rich country, and there are foundations for all kinds of. But they are all about. It seems to me not all about, but many of them are all about reacting to a crisis, reacting to a situation that is dire or is becoming dire, right? As opposed to doing a lot of groundwork. Do you
right.
think that's part of it? And then the other thing, I mean, this podcast has gone very fast. The other thing I want to talk to you about is the coalition. If you can just talk about who are the members of the coalition. So first one is, and then there is your book. I think we should do another episode maybe at some point. I want to talk about your book as well. Anyway, so number
Yeah,
one,
let's do that.
prevention. Number two, the coalition, if you could.
So, I have a colleague that actually worked with me on the book, who came up with this concept. Just as you said, hospitals and our medical care system is very reactionary.
Yeah,
And so we go and get taken care of when we're sick. Well, the way this particularly impacts the, low income folks who we were just talking about is they don't have the money. They don't, a lot of folks don't go and get the care they need early on. And so
yeah,
they're already in an advanced stage of sickness because they're not going to the dentist twice a year. Typically they're not getting the regular checkups they need. And also there's an equity issue because a lot of folks, particularly if you're a person of color, there's a lot of mistrust about the medical and health industry because we know all of the horrible things that happen. Black folks were literally used to test out syphilis back in the 100 years ago. So there's a lot of mistrust in the black and brown communities around the health system.
yeah,
And when you combine that, if they happen to be low income, there's a lot of it makes all of these challenges, you know, go from acute to chronic pretty
yeah,
quickly. So the DC Coalition on Long-Term Care it's a fantastic coalition that has consumers, people that are getting long-term care, and also providers, the agencies that employ the workers that go to people's houses or work in, a nursing home or an assisted living place. And so our coalition literally is ecosystem's a word that we all use too much, but it literally is an ecosystem of the entire long-term care system. And so we work with engaging and advocating with local government. We work with the hospitals in the Washington, D.C. region. We're obviously working with clients, with people getting the care they need, and caregivers. And so, if there's anyone interested that's listening to the podcast that want to join the coalition, you can join as an organization or you can join as an individual. And there's no fee currently. And we may have, some minor fees later on in the future, just so we can pay for laptop, things like that for the coordinator. But there will always be an opportunity for people to join the coalition, free of charge.
yeah. No, I attended um the last one, I think, last one was a few weeks ago, right? And it was
Yeah.
amazing. I mean, I really got such an education and obviously the context and so forth. So I would advise you to ask people to pay a little bit, right? Because because you're
Yeah.
doing amazing work, and I think that the value there, I mean, is just incalculable. In terms, I already made contacts. I'm gonna have Gibran on my podcast. Of Eubanks. He's an activist, and so anyway, I really want to have another shot at you, so to speak, because there are many things I didn't talk to you about. Maybe so we can arrange something again. Let's call it part two of this conversation, offline. We can arrange that. Are you open to that?
Oh, absolutely. Absolutely. And we'll connect these podcasts to the coalition, we'll disseminate them. This is a great way to educate everyone who's part of the coalition. And quite frankly, we can send it out to to elected officials. This is an issue we need to educate
Yeah.
all of us.
I would like to, yeah, I definitely, I mean, I'm a big believer in getting folks who are doing adjacent things together because, it's just a bromide to say, but, the whole is always much bigger than the collection of this, what the sum, whatever that is, right? Of the parts, right? And I think there is definitely a huge opportunity here. I think there's an opportunity everywhere, but this one here, because the urgency and the impact is so massive, and all these people are doing a lot of work beyond the call of duty, to be honest with you. I see them doing really a lot of good stuff
Yeah.
because they are driven by a mission. And so getting them connected together is just feels to me like we should invest in doing that.
You might want to do a, podcast with a worker, and we
No, no,
can,
absolutely, absolutely. No, absolutely. I mean, I have done one the last episode I did one with the service coordinator, in a food desert, which was a fascinating conversation, right? They
Mhm.
are somewhere in Ohio, and so just the basic problem of getting these folks, like she was saying, fresh tomatoes is huge, right? Because they have basically a gas station, and you can buy canned food and so forth, but fresh produce,
Right.
even though they are in rural area, right? Which is amazing, right? I mean, so you learn. So absolutely, the folks on the front line are essential to this conversation. Again, I would love to work with you to figure out. We are a technology company, so I want to see what we can do in terms of providing you with some for free, obviously, right? Some
Yeah,
infrastructure stuff that you can use for communication and so on, because that's how it works. It's like you said, it's an ecosystem, and let's give it some meaning when we say that.
absolutely.
All right.
Forward
Okay,
to-
well, Ian, thank you so much. I'm going to bug you again. So, for
Yep.
sure. This was very
All right.
enjoyable.
Until next time.
Until next time, stay tuned.
All right. Thank you,
Take
sir.
care. Bye bye.